Hi, I'm Dr. Kevin Shaw of Sound Holistic Health, and today we're going to be talking about neuro acupuncture and the different things that it can help with one of our acupuncturists here at the clinic, Mr. Jim Burr. So we're happy to have him with us, and I'm going to do a little intro to Jim. Jim's been here at the clinic for a number of years now. So how many years actually has that been, Jim?
Since 2012.
Okay, great. Yeah. So a number of years, Jim's done a good job with a lot of patients, been able to help them, and I'm going to let him tell you a little about his experience and his different types of training, right? So when you first were in school, you went to a particular type of acupuncture school, correct?
Yes, I went to a 5-element style school, sometimes known as a Worsley school. J.R. Worsley was a British Army colonel and doctor of osteopathy who became interested in acupuncture in the 50s and 60s. Couldn't go to mainland China, but went to Vietnam and Korea and Japan, Taiwan, Hong Kong, learned as much acupuncture as he could. And so it's a very popular style in Britain. About 1/3 of acupuncturists there train in 5-element style, whereas only about 2% here in the U.S. train in 5-element style.
So it makes you a specialist in that area.
Yeah, in a certain sense. And it's a style of acupuncture that focuses in part on dealing with psychological, emotional, and what we might call spiritual issues. And these were all things that mainland China wasn't interested under the communists in developing or exploring, and so it didn't make it into the curriculums for 98% of the schools in the U.S. come out of what's known as TCM, traditional Chinese medicine.
Right, and I could definitely attest to the fact that I think ever since the 50s, Mao Zedong and them trying to pull all the spiritual aspects, mental, emotional aspects out, the whole rest of the acupuncture world's been trying to put it back in again, right? And there's been lots of things written about that, but the 5E school has really focused the most on that.
Yes.
Yeah. Okay, good. And then more recently, you've been excited about another type of training you've been doing. So maybe you can tell us a little bit about the neuro acupuncture.
Yeah, so I've been studying neuro acupuncture, and this is a style of acupuncture that's really quite recent. People have been putting needles into the scalp for thousands of years in China, but it's only since the beginning in the 50s and really fully developed in 1971 under a Chinese neurosurgeon, Dr. Jiao Shunfa, who began to correlate the regions of the brain with the scalp acupuncture points so that we can stimulate the motor cortex, sensory cortex, and treat a wide variety of neurological conditions with acupuncture.
Right.
And I've studied over the last year with 2 students of Dr. Jiao Shunfa, doctors, a husband and wife, Dr. Jason and Linda Howe in New Mexico. And so we've learned to treat a wide variety of neurological conditions, things like traumatic brain injuries, spinal cord injuries, post-stroke paralysis, neuropathies. I'm treating some autistic children right now. There are a great many things that can be done with this that Western medicine has kind of thrown up their hands with a lot of these things, and for much of Chinese medical history as well. But we're now beginning to find that we can stimulate the brain through scalp acupuncture and begin to restore some neurological function.
Sure, and definitely some of my experience, I saw that people like post-stroke were able to have a lot of benefit with acupuncture, especially if they got treatment quickly. So there were studies showing benefit that not all of them as beneficial as others, but I definitely in my training saw that. I'm sure you've seen that with even more focused approach with the scalp acupuncture. And there's also the fact that from a neurological standpoint, a French neurologist had studied auricular acupuncture when they were doing points on the ears, had studied that quite extensively before and correlated the Chinese ear map with a map that he came up with, the French map, and studied a lot of what he saw the results of with specific points And in Chinese medicine, there are lots of different maps that people use to activate different parts of the body or the nervous system, and some of them are specialized to different parts of the world, right? Like Korean hand acupuncture, for example. And so this is kind of another map, but it's one that's had more modern approach to it.
Yeah, it deals much less with traditional Chinese medical concepts, and more about taking Western neuroscience, neuroanatomy, and saying, well, we've got our central sulcus here and post-central gyrus.
Right. Working
so
on the motor side.
We have our motor homunculus or sensory homunculus.
Right.
We have regions of the brain for treating tremor. We have the occipital region of the brain for balance and vision with the cerebellum,
right. Sure.
Right below the occipital region of the brain. And so we can improve people's balance, we can improve vision. We've got areas for hearing just above the ears and those regions of the brain. Regions for treating aphasia when people have lost the ability to speak,
right.
whether as a result of a stroke or some other cause. We can stimulate the speech centers of the brain.
Sure. Mainly on the left side of the brain, yes. All right, great. So what kinds of things have you seen so far with patients?
I have had some really good results, even with conditions where it's occurred long ago. I have one patient who was coming to see me for anxiety, but had had a traumatic brain injury several decades earlier.
Right.
And as a result, was walking with a walker and had very severe tremors like this. And once I started learning the Neuro Acupuncture, I said, well, you know, even though it was decades ago that this event occurred, why don't we give it a try, see what happens?
Right.
And we were able to reduce the tremors in his hands. So he still has a slight tremor, but it's much more like this now.
Right. So that's a lot better for function, being able to do things because you have more control with your hands.
He's been very excited that he can actually pick up a potato chip without crushing it between his finger and thumb, and actually eat the potato chip. Can grab a pop can without putting dents into it.
Great.
His balance is better. Some of my autistic patients, their parents are reporting that they're sleeping better. They're much more emotionally calm and level, starting to interact more, speaking a little bit more. And
right, so some maybe moderating some of the overstimulation that's coming into the brain so they can actually interact with their environment more. Instead of shutting everything out.
Yeah, we can start to balance the endocrine system with some of the points at the top of the head.
Right. Okay. Excellent. So I'm excited that you've been doing this training, and you have a little bit more to go to complete the entire series, right?
Yeah, there are 3 levels of training, and I've done the first 2, and I'm hoping to get to the 3rd level this April.
Great. And, excellent. So it's awesome that you're already having really good results with it. I think that probably a lot of other acupuncturists can attest to the fact that you start learning some of these protocols and you're seeing patients, you're working with them and seeing really good results depending on different conditions that you're treating, and you feel like you haven't even trained in that condition very long, so it's pretty amazing how well it works for people, right? It's not like you have to have done it for 20 years to get a result. Right, you can get really good results initially.
Yeah, and I have seen just from visiting New Mexico and doing the training, we have a lot of demonstration patients who come in, and some of them just incredible results. One that comes to mind, there was a man who in a snowboarding accident who had completely pulverized his 11th thoracic vertebrae. It happened in France. The French doctors there said they gave him a 1% chance that he would ever walk again. And that was maybe just to give him, not to completely crush his hopes.
Right, give him some potential.
Give him some potential, a 1% chance. And he had only had 3 or 4 sessions previously with Drs. Jason and Linda Howe when he came in as a demonstration patient for our seminars. And at that point, he was already able to get up out of his chair by himself, grab hold of his walker, and then he was able to walk with a walker. And every now and then, he would let go of his walker and stand straight up with his arms up. And this was with a completely pulverized 11th thoracic vertebrae.
That's
Most
pretty
people
incredible.
would simply say, well, you're never going to walk again.
Too much damage on the spinal cord.
Yeah. And as long as the cord hasn't actually been severed, if it's simply been severely bruised, there is still hope that we can restore function.
Right, and that's great, and it is amazing because a lot of times we tell people, after a couple years of some kind of neurological injury, there's less hope of things improving, and I would say that's a general rule, but obviously there are exceptions to that, and with this type of technique they're seeing some exceptions, so that's great.
They have, and they themselves felt it's best to get in within 3 months or so, and they've occasionally had demonstrations patients where they learned, oh, well, this injury happened 11 years ago, and it's okay, well, we're not really sure what's going to happen here.
Sure,
you don't want they themselves have been surprised that they've had somebody who'd had their left arm paralyzed for 11 years, and they said, well, we'll put in the needles in and then send them off stage, and then they heard a shout from the patient's wife, and she came back in. He was moving his arm. And,
great.
So
that's exciting to hear.
Yeah, that's very exciting, and so even they have been surprised by some of the results that they weren't expecting.
Sure. So, what we can say is it's definitely worth investigating for people, but we can't promise that every single thing is going to improve.
We can't promise miracles, but we can say that we have a better chance with this than anything else that we've
it's a technique that offers options that weren't available in the past, right?
Yes.
So, great. Okay, so I'm real excited that you're doing that training and that we have that here in the clinic to offer to people. And also another thing you do here at the clinic is you have a community acupuncture event in the evenings on Wednesdays at 6?
Yeah, from 6 to 7 p.m. every Wednesday. I'm here doing group acupuncture. We set up a circle of chairs, and I give everyone the same base protocol of needles in the ear, which is a protocol developed by the National Acupuncture and Detoxification Association. It was originally designed for treating heroin addiction, but it's subsequently been found to be very useful for people with post-traumatic stress disorder. And I also use it here because it's just a great general stress relief.
Absolutely. There's so many people with so much anxiety and depression and stress-related issues, whether it's work or family, and with our whole situation that we have, and I'm not going to go into specific politics, but there's just people stressed about all the issues that are coming up and the divisiveness in the world. So since I've been practicing the last 12 years, I've just noticed people's stress levels just going up and up and up. And it's nice to have something to help compensate and bring it back down some so they're not constantly in the fight or flight response.
Yeah, that is the major thing that happens with the insertion of the needles in the ears. We have a point called the parasympathetic point, or sometimes the sympathetic point. But it balances the sympathetic and parasympathetic nervous systems. Your sympathetic is the fight or flight, parasympathetic is rest and digest. So we're sending people from fight or flight response into a rest and digest.
Sure.
Sometimes people get so relaxed they'll fall asleep in their chair to doze off. And,
absolutely. I like to tell patients that the rest and digest is very well exemplified by looking out into pasture and seeing some cattle out there just chewing their cud. All they care about is just getting their food processed. They don't have a care in the world. And if something scares them, they'll run like 20 feet away, and then they'll stop, and they'll go right back from that sympathetic fight or flight into parasympathetic mode. And they do that so much better than humans do. I don't know exactly what the reasoning is for that, but we seem to have much more trouble getting back and compensating for that stress. And so it definitely helps to have techniques so that people can relax and have their body work properly. There's so much of a neural network in the gut, right, that is activated and or inhibited actually when the fight or flight response and the sympathetic gets going, and we really want that to be working for us almost all the time. So that's great. So that again is on Wednesdays at 6. It goes to 7, and people they don't need an appointment for that.
They
can just come to the clinic.
They can just show up at 6, even showing up as late as 6:15. We can still get you in. And this is on a sliding scale donation basis. I have a suggested donation for people of $10. But I'm quite serious when I say that no one will be turned away for lack of funds. I consider this a community service.
Right.
We live in an area with the highest number of heroin-related deaths and opioid-related deaths in the state of Washington, and this is one of the things that can really help people to cut their cravings, their addiction to these substances, and I would really like to see more people taking advantage of it.
Right, so absolutely. So it works both on the physical cravings and also on the mental, emotional, psychological factors that happen, and that's really good to try to break things from both sides there, of course. And definitely, I think the NADA protocol is very, very helpful for that, and they have shown back east that they had a lot of benefits with this, reducing recidivism in some different jurisdictions where they offered it as an alternative to going to prison if people went to this protocol.
Yes, part of my training at the acupuncture school I attended in Maryland, Tai Sophia, it's actually the oldest accredited acupuncture college in the United States. It's now known as the Maryland University of Integrated Health. But part of my training, they required us to do 60 hours of performing the NADA protocol in various heroin treatment centers where a lot of people there were not there voluntarily. It was under court order from the state of Maryland saying that you have a drug problem and this is part is part of your sentence that you need to attend these meetings and receive the treatment. And many of them would continue to come after they had served their time because they recognized it was really effective.
Sure. And one other thing I'd like to point out about that protocol is, as we said, it's used for a lot of different things. Heroin is obviously known as highly physical, addictive substance, but the same protocol or very similar variations of it are used for smoking, alcohol. You can use it for sugar cravings. I mean, pretty much anything that you are self-medicating with in order to try to balance your body, we can balance it in a different way. Right.
We used a slight modification of that protocol when I volunteered at Walter Reed Army Hospital in Washington, D.C. With the Wounded Warrior Program. We had vets coming back from Iraq and Afghanistan. We'd put the needles in their ears, and it would give them a lot of relief from their PTSD symptoms.
Sure. And and actually people have done that same technique kind of worldwide. After different catastrophes, people have gone in, acupuncturists without borders, and tried to help earthquakes, et cetera. So it's really awesome. So I'm glad also that you offer that as well as a community service and encourage people to take advantage of that, or if you know someone, to try to get them some help. We're happy for that. So if people want to look at your website, it's...
they should visit www.jamestburr, BURR, and .com. And you also have the option of booking an appointment right there on the website if you'd like. Or you can always give Sound Holistic Health Clinic a call at 425-258-4633 and set up an appointment with me that way.
Sure, right. We also have information about you on our website at shhclinic.com. And I think one last thing I want to say before we go, do you have any other comments you want to share, or are we good?
I think that's good. Other than, I would say one other thing I want to add about the Neuro Acupuncture is that is another area for anyone suffering from post-traumatic stress disorder. The Neuro Acupuncture can really help. And one of the things that amazed me, I've heard, of course, about phantom limb pain, that people who have lost a leg or an arm, whether in war or otherwise, continue to feel pain in the limb.
Or itching or something else that drives them crazy.
That just drives them nuts. But I didn't realize that 75% of amputees were experiencing this. And this is something as well that neuroacupuncture can help with. So if you know veterans, whether it's PTSD, whether it's amputations, whatever troubles they might be experiencing, post-military service, there's a lot that we can offer for them here at Sound Holistic.
Right. So that actually made me think of another question, which is regarding neuropathy. So in your trainings with the neuroacupuncture, have you seen much information about or results with that?
We have, and I've even seen it here clinically. One of my patients is a bus driver with community transit and has neuropathy in his legs from spending all this time sitting on it. And we used neuroacupuncture with him, and he reported a 95% reduction in the neuropathy in his feet and legs.
Right. And so I love hearing that. We definitely work on that with patients here, and also can combine with other techniques we have here. We have a device that works on microcirculation that also greatly helps with neuropathy and the experience we've had in the clinic. So it's nice to have some tools for people. When you were talking about that, it made me think about all of the diabetic patients that also have issues with nerve function, and thinking, oh, so we need to let them know as well there are some potential help with that.
Yes, and complex regional pain syndrome is another thing that can be addressed with neuroacupuncture.
Sure. So if you're wondering, you can send us message through Facebook. You can call up the clinic. You can look at Jim's website. Hopefully you can comment on the video, and we will respond and get back to you if you have questions. And yeah, I think there's a lot of potential here to help a lot of people, so I'm very happy with that. And I'm also just going to mention that next Wednesday I'm going to be doing another one of these Facebook Live events, and I'm going to be talking about basically how to save money with intermittent fasting and dietary variation protocols you may be following. I've got some ideas of where you can get some of the things that are useful for that inexpensively, some of the foods and supplements that can help with that, a couple of tools and tips that I want to share. And in the future, we'll be also doing more in-depth work on talking about the intermittent fasting, dietary variation, fasting mimicking diets. These are all things that are much in the news over the last 10 years, especially the last few years, because we're seeing so many ways that they can help people with really quickly changing some of their problems, whether it's hypertension, diabetes, and watching. And thank you. Say both at the same time. Because they often go together as well. So I'm happy to be able to share some information about that. So we'll look forward to doing that next Wednesday. And for now then, I guess we will sign off and thank everybody for participating.